Kohler, and this is my SBAR for week 2 of MedSurg. Okay, so we have patient Amanda Anderson, 18 years old, white female, senior in high school. Admission date was 4/7 last night. She came in at 10 o'clock. She was assaulted by her boyfriend at 8 p.m. at her residence. Initially, she came in and her diagnosis was acute pain related to breaking one of the bones of the rib cage as evidenced by guarding and pain upon breathing. She has no known allergies. She's a full code. No isolation precautions, nothing like that. The only past history we had on her is bulimia nervosa, which she was treated with cognitive behavioral therapy. She's clear of that right now, no issues that way. Currently, what she's dealing with is bruising on the left flank, the left ribs, with some left upper quadrant pain upon breathing, deep breathing, coughing, all the typical fractured rib type of pain, and she's guarding. So, brought her in. Mom brought her in. She lives with mom, dad, 3 older brothers. She identified the boyfriend as the assailant. So she's refusing a full assessment at this time. But she did let us do a basic assessment. Right now, she's also refusing a SANE exam. So we're going to revisit that after we check her out and see if she changes her mind about that and see if she would like to press any charges as well. So she's alert and oriented times 4. She's talkative. She's clearly understood. She is reporting her pain at a 7 out of 10 right now. We have taught her how to pillow splint. So if she does need to cough or sneeze, anything like that, it'll help relieve the pain a little bit. Taught her about sitting up in the correct position and just really driving home rest, as much as she can to try and not run around or anything like that. Just kind of stay seated while she's in the emergency room right now. And she's describing her pain as sharp and constant. She was given Tylenol this morning at 6 a.m. She responded well to that, no issues. Her skin is warm and dry, normal turgor. Her skin is intact. She does have some bruising on the area where she's saying the impact happened, swelling, redness, really tender, and there's some pattern bruising. She's saying that it's a little bit of relief with the pillow splinting, not much right now. Let's see, pulse, strong, regular. Her vitals were taken around an hour ago. Temperature 98.8, blood pressure 126/78, heart rate 90, respirations 14. She's on room air. She's at 98%. Her breathing is a little labored with the pain, but everything is clear. All fields are clear. It's auscultation, and she doesn't need any kind of oxygen or anything like that at this time. Bowel sounds were normal, present in all 4 quadrants. Last bowel movement was 4/6. No pain with voiding. Yellow. No real odor. No cloudiness. The urine was clear. We are suggesting at this time to send her down for x-rays of her left side, of course. And also her reflexes. All her DTRs were normal. Her upper and lower extremities, the muscle strength was fine, 5 out of 5. Range of movement was normal. Of course, the left arm, you could feel the pull, so there's a little bit there, but still normal range of movement. She was able to tolerate all the exercise as well that we use to assess that. So again, recommendations are going to be her chest x-ray on the left side. We want to get a social work consult in there because she did say in the safety screening that she feels unsafe at home, that she's afraid that this is a repeat assault happened before, with the evidence of the abuse and the pattern bruising on the left rib. There's also some evidence of prior bruising at different levels of healing. So we want to get that checked out. Since she did identify the boyfriend as an assailant, we've also offered to contact the police if she'd like to press charges or get a restraining order in place, whatever. And right now she's still not going for the SANE exam, but like we said, we're going to revisit that. We're also bringing a domestic violence advocate down to sit with her if she does choose to go through the exam, and if not, just have somebody there to speak with her. So that's where we're at right now. And that is my assessment and my SBAR. Thank you. Bye.